Welcome, welcome, welcome. It is time for Ask Dr. Geier Live. Wherever you're watching, I hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you look, feel, and perform your best regardless of age or injuries. Yes, I'm going a little more casual today. This is hopefully the last day I am working of this year until I am seeing patients in the office for a couple of half days right before New Year's, but that should be about it. So I am already in holiday mode. I hope you're having a wonderful start to your holiday season. Those of us here in the United States, I hope Christmas and New Year's planning and everything else is not too stressful for you. We're going to do quick question and answer. I'll stay as long as there are questions, and we'll kind of go from there. Georgia says hello. Always good to see you, Georgia. Mary also says hello. As always, what I always say is if you have questions, feel free to answer to post those. Put them in the chat, not in the comments. I can't see the comments. I can only see the chat if you're on X and I'm not responding, then you might try going to YouTube and enter the questions in the chat. But you can just see where Georgia and Mary have posted and then just post your questions over there. Also, this is not meant for medical advice. This is meant for general information and educational purposes only. I haven't seen you. I haven't examined you. I haven't looked at x-rays, MRIs. I'm not your doctor. You're not my patient. If you want more information about how you can see me as a doctor, the information on that is below. You can click the link and find out more about potentially working with me. But that's just how it goes anytime we do this kind of thing online. Also, this, at least temporarily, is the last show that we will do Fridays at 12 p.m. Eastern time, or whatever the time is wherever you are. Starting in 2025, I'm moving to Monday afternoons, 5 p.m. our time. We'll see how that goes. I've had a lot of people ask to do it later. They couldn't get to this time. Either Fridays were hard or lunchtime, or depending on if they're on the West Coast here in the United States, that's relatively early in the morning. So we're going to try out Monday afternoons. We'll see how that goes. Those of you that have been with me a long time know that I've tried these at various times. It's been Friday at noon for the longest time, but I've done Wednesday nights, I've done Monday nights, I have done Thursday afternoons, so we'll try Monday. All right, real quick, we may not have many today, which will be good for everybody, I guess. Does grinding in the shoulder, is it harmful? Yes, she has arthritis. Yes and no. So the popping itself is not necessarily detrimental, but if and it sounds like in the case of arthritis where I don't think I can show you on my model, but the ball and socket, normally that cartilage is smooth, and as you go through a range of motion, that joint motion is smooth. There's no friction. But when that cartilage starts to break down, you get exposed bone, you get bone spurs. Yes, that can cause popping. It can cause pain. Yes, but yes, in theory, over a long period of time, that can further damage articular cartilage. Having said that, if you're watching this and you don't have arthritis, but you do feel a popping sensation, very often that's not harmful. It can be caused by fibrous tissue, scar tissue in what's called the subacromial bursa. So you go through a range of motion, reach overhead, out away from your body, behind your back, and it gives you a popping sensation. That's not necessarily harmful. So that, I know that's not an absolute right or wrong answer. It depends on the condition. Generally, as orthopedic surgeons, we don't get terribly concerned for popping because there's not a lot that you can do for it, both non-surgically and surgically. But yes, if in the setting of arthritis, it can, over a long period of time, that roughened articular surface can cause further breakdown. Liz says, left calcaneus insufficiency fracture, left Achilles tendonitis, left knee spontaneous osteonecrosis. Yeah, not so much an easy answer because none of those are necessarily the same. The avascular necrosis of the knee, there's not really all that much you can do short of when it gets bad enough a knee replacement. There's no real surgical treatment or regenerative treatment to help that bone heal once that's happened. Achilles tendonitis, typically there are modalities, things like shockwave can be helpful. In the regenerative world, things like PRP can potentially be helpful. Physical therapy can be very helpful. Sometimes ice might be helpful. That's something typically does not need surgery. Now, when it becomes a tendinosis where you get degeneration within the tendon, then there is thought that that may be a precursor to an Achilles tendon rupture. That's where the regenerative treatments potentially like PRP, like exosomes or stem cells, if you're somewhere that you can do that and it's good quality stem cells, that those can be options, but that's typically that. As far as the insufficiency fracture, it's about one, allowing that to heal, but then two, preventing it by increasing bone density. Those typically are related to decreased bone density, so you typically see those in women and especially older women, and you have to fix that underlying problem. All right, is there a surgery for that, for the popping, grinding? Not typically so much. There are surgeries when you have significant arthritis. Again, if it's the glenohumeral joint, you're typically talking some form of a shoulder replacement, reverse ball and socket, things like that. AC joint arthritis, you can do what's called a distal clavicle excision and basically eliminate between the end of the collarbone and the tip of the shoulder blade. You free up space and you eliminate issues with range of motion and potential grinding and pain that comes with that. All right, that's a quick day. I'm going to end it since that's all the questions we have. I very much appreciate those questions. I'm very much looking forward to seeing you in 2025. I hope you have an amazing holiday season, Christmas, or whatever it is you celebrate. Hope you have an amazing and safe new year, and I will see you right back in 2025. Have an amazing rest of your holiday season, and I look forward to seeing you soon. Take care.